Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: compressed air safety. Compressed air tools are commonly used in many workplaces. Many workers take them for granted, ignoring the hazards involved in their use. Compressed air is not just air. It's a focused stream of air driven at a high velocity, which can cause serious injury or death to its operator or persons in the immediate area. Compressed air is often misjudged and not recognized as a hazard because people often think of air as harmless. Caution: serious injury may occur. Did you know? Air forced into body tissues through the skin can cause an air embolism, air bubbles in the bloodstream, which can be fatal if it reaches the heart, lungs, or brain. Inflation injuries of the intestine can be caused by air being directed at private body areas. A worker in the UK died of injuries sustained through horseplay with a compressed air hose. This act of horseplay can be deadly. Air blown into the mouth at only 5 psi can rupture the esophagus or the lungs. Eye and ear injuries can occur from a blast of air or flying particles. These types of eye and ear injuries can cause partial or total loss of sight or hearing. The sound from a compressed air hose can reach 120 to 130 decibels, which is well above OSHA's 90 decibels and Canadian 85 decibels permissible exposure limits. 40 psi can blow out an eardrum from 4 inches away and possibly cause brain damage. As little as 12 psi can blow an eye out of its socket. Flying particles can cause cuts and bruises to any part of the body. Safe usage of compressed air includes: hoses and lines should be rated to meet the maximum operating pressure of the equipment. Always wear proper personal protective equipment. Safety glasses with side shields and a face shield if needed. Hearing protection. Respiratory protection, depending on the materials being worked with. Normal work clothing is not protection against compressed air. If you must clean with compressed air, do not use air that is set above 30 psi. You must also have effective chip guarding and proper PPE. Never use compressed air to clean clothing or hair. Never point compressed air at yourself or another person. Before turning on the air pressure, make sure that dirt from machinery will not be blown onto other workers. Don't kink the hose to stop the airflow, always turn off the air and the control valve. Did you know that flying particles can cause cuts and bruises to any body part? 12 psi can blow an eye out of its socket, 40 psi from 4 inches away can cause brain damage, 5 psi of air blown into the mouth can rupture the esophagus or the lungs, and high-pressure air injected through the skin can cause an embolism which can be fatal if it reaches the lungs, heart, or brain.